Greetings again from Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk a little bit about this afternoon about ramped bite plates. Now, if you put a ramp on somebody's mouth, the main purpose of the ramp is to make the person bring their jaw to a certain position out here, and every ramp has a built-in bite plate to it. But you can have bite plates that we put on all deep bite cases, and most of the cases would just be a acrylic on the retainer where the jaw closes in here and you have a bite plate. But if you put a ramp, the ramp will guide the jaw into a forward position that is where you need it to take care of a TMJ problem. And most of them where we have TMJ trouble back here, if you can advance the mandible a little bit and get the condyle off of the retrodiscal tissue, that's what's normally bothering back there. Then you put the ramp on there, and they have to bring their jaw forward for it to slide. As it does, it brings the condyle forward, and then splits you have as they come forward. You wouldn't have any contact with your from bicuspid to molars back here, so the split fills that gap in so that you're chewing on the bicuspids and molars, and the load goes up through the bone structure here and doesn't give you any problem. Now, if you just put a ramp on somebody and didn't have the split part back in the back covering the teeth, then the load would be on the anterior teeth right out here and your jaw joint. And some people can take that for a while, but after a while that gives you trouble. You're putting too much pressure on this condyle, and it's pressing this disc, and it's in a forward position anyway, so this just doesn't work good. So you build a split that brings the jaw forward and also has acrylic covering the teeth so that the teeth close in that same position. The teeth come together and the load goes up and down through the bone, and the person can tolerate that. So let's just kind of look at some of these ramps and also the bite plates, and what we do when somebody's having some kind of joint problem. I've done this with lectures a lot of times. Excuse me. I would just have people sit in a normal position with their head, shoulders in a normal position, and just kind of open and close your mouth, but don't let your teeth touch. Just kind of come in. If they touch, just very lightly, and all of a sudden you close too, but don't move your jaw, and see where your jaw's hitting. And most people will want to bring their jaw forward a little bit, and you go back and you get the condyles back in the socket further, and that is uncomfortable for a lot of people. So if you can get the jaw to close together and the teeth fit at the same time, and the jaw is closing where it wants to go, you have very little trouble with TMJ problems. And you can have arthritis, you can get trauma and things that don't relate to this, but you can take care of the bigger percentage of TMJ problems just by putting the jaw where it really wants to go, and then you make the teeth fit where the jaw wants to close. Now, we've had many examples of that, and I think I've covered that in many videos on deep bite cases and stuff like that. Now, once I used to do the TMJ stuff for Dr. Holt, who would work with the TMJ, and he took them out of pain. He would send them to me to work on, so they could do without the ramp. So he sent me a lady one time who was a chiropractor, and she had perfect teeth, and the teeth fit together just perfect. And yet she had a jaw pain in here. So I had to advance her mandible and then bring the maxillary teeth forward so that they could close into this anterior position. And the way we did that, we stripped all the teeth, and then we used some class 3 elastics in here that would bring the class 2 would bring the upper teeth back and the lower teeth forward, and we could reposition where the jaw fit in there, and it made it fit where the teeth fit together, and the jaw was closing in the position it wanted to go into. Now let's take a look at some of these ramps. Now this is the way we make the ramps. You got a retainer, or if it's a splint, you'll have this solid acrylic going all the way back over the teeth, and you mix up some acrylic into a little bowl or something, and you put a cotton roll in there, and you put this acrylic and you press it in there against that, but don't let any of it get under on the lingual side or on the palatal side of this retainer or splint base that you're having here. And you can press that. Now here's the way we take a little dish and you soften some acrylic up and you roll it around and take it out and put it in this place right here and press it down and kind of get it fitting in here. Now you put this in the patient's mouth. We'll go around and we've got that acrylic in there, but be very careful that none of it is over on the palatal side of that, so you want this to fit in the mouth good. And now you take it and you need to clean all this off and everything, put it in the mouth, and then take your finger. Now this was done before we wore gloves, and then we put this retainer, we're just making a bite plate here, and with a little bit of a ramp. And now you're going to put your finger in here and push this acrylic up against the back side of your upper front teeth, like that. Now there's the finger pushing this up, and you can, if you make a ramp, you do this very same thing, you just have a lot more acrylic in there, and you come up underneath it, and you leave a ledge of this in here, and you put a slope in it so that the jaw can't close until it gets up in this position that you're trying to position the jaw to. Now, here you put this in, and you have the patient bite. Now, don't put their head back. If you do, your jaw goes back. If you put your head too far forward, your jaw goes forward. You want the jaw to fit in a normal head to shoulder relation. That's where the only place it'll fit. If you lean back like this, it hits your jaw, go back, and the bite plate will be in the wrong position. So you want it, it's just one spot in there where it's going to fit. And that's in a normal head to shoulder relation. And now when we get in that relation, we move the teeth so that they fit together while you're closing in the right position. Now here we've closed this, and we'll leave a little ramp, and see there's a track of these teeth. If we want to make a ramp with this, we would grind it off at an angle in here, and the person would bite and hit like here, that they have to move their jaw forward. And here we just are going to do the ramp, and so we take that and grind all this acrylic out, but leave the tracks of the teeth here with a little short, tiny little ramp, and they wear this during the daytime. A lot of people, we have to build a large ramp so that they wear it at night, and during the daytime they have a small one and they keep their jaw up here. And this is the way we advance mandibles on some of these cases you've seen that look so much better, and that solves the TMJ problem too in most of the cases. All right, so now this is ground off. When you go to close to your lower anterior teeth, are going to fit in this little track right there. And that's what we use on every deep bite case. We'll have a ramp like that. And most of the retainers we made, we have put ramps on them, or not ramps, but just bite plates. Now here is a ramp that we made for somebody that was, you had to get their jaw forward quite a ways. So we put more acrylic on here and pushed it up underneath here, and we let the person come to, and then they can take their tongue and push against that and shove it up against the back of the front teeth, the lower front teeth. Or you just push that with their tongue, and you end up with this acrylic ramp like this. Now this is the type you wear at night, and you can drill holes in them to get air through there if they're mouth breathers. But anyway, we pull the jaw forward with the ramp, and the ramp has an automatic bite plate on it. It doesn't matter. And the ramps are for TMJ problems that you need to advance the mandible, or if you want to just advance the mandible to make somebody the facial structure better, and they'll bring their jaw out and their teeth kind of tilt on this, and the head of the condyle will go out, allowing the jaw to come forward some, and the angle here, the gonal angle will, the elbow you straightens it out, it lets the jaw come to a forward position like that. Now let's go back here and I'll see, I think that's the end of this video, but I want to tell you that this is an important thing to learn how to position the jaw where it wants to be. So if you got somebody that comes in and they've got a sore joint on either one or both of them, and just let them close their jaw and setting in a normal head to shoulder relationship. And when they get the teeth, this is right where you want them to, the jaw is closing and nothing. You take a little ink pencil and mark where the teeth are. And now you come in and you build a ramp, and you have the teeth touch or come together at the end of it where that mark is. And now that makes them close in this position that is good for the jaw joint. And so if you get the teeth fitting together and the jaw hitting where it should hit, then that takes care of a big percentage of the TMJ cases. Thank you for watching, and I hope you'll join our group and subscribe to it. And I'll say goodbye, and we'll hope to see you again in some other videos. And I'll say stop this at this point. Thank you now. Goodbye.